Hello everyone, I am Sagar Shingare, second year MBBS student from Dr. Ullas Patil Medical College, Jalgaon. We are going to study about the drug acting on skin and mucous membrane. So in this slide basically we will study about the psoriasis, drugs for psoriasis and about the photochemotherapy and also the demyelinizing agents. Psoriasis is basically an immunological disorder. It manifests on localized or widespread erythematous scaling lesions or plaques. Drugs can diminish the lesion but cannot cure the disease. Topically applied emollients, keratolytic, antifungal afford variable symptomatic relief. Topical corticosteroids are the primary drug used. In this slide you can see different types of psoriasis. You can see over the hand it's plaque, over the back it's gutted, over the foot it's pustular, over the scalp, over the nails and over the body, overall body you can see the psoriatic erythroderma. So basically three drugs are used for the treatment of psoriasis: calcipotriol, tazolidine and coal tar. Calcipotriol is a non-hypercalcemic vitamin D analog, effective topically in plaque type of psoriasis. Its benefit in psoriasis is slow, but most common respond in 4 to 8 weeks. It has moderate potency. Side effects are skin irritation, erythema and scaling. Hypercalcemia is rare. It is safe and effective alternative to steroids but expensive. Calcipotriol example can be Davonex, which could be applied over psoriatic lesions, which should be applied twice daily. The next drug is tazolidine. Tazolidine is a synthetic retinoid. It is applied as a topical gel. It is moderately effective in psoriasis. It is basically a prodrug hydrolyzed in the skin to tazarotenic acid that exerts anti-proliferative and anti-inflammatory action. Skin irritation, burning sensation, peeling are common side effects of tazolidine. Some of the example of tazolidine drug are Latase, Tazaret cream, which is applied once daily in the evening time. The next drug is coal tar. Coal tar is a crude preparation containing many phenolic compounds. It exerts a phototoxic action on the skin when exposed to light, especially ultraviolet A, and retard epidermal turnover. Use of coal tar has declined now because of strong smell, cosmetic unacceptability, and skin irritation, allergy, potential for photosensitivity, and carcinogenicity. The coal tar drugs are Exeter, which include coal tar, salicylic acid, sulfur precipitate. Another is Starcel and another is Ionex T. This was all about psoriasis. Now we will study about photochemotherapy. Photochemotherapy, in which the term is PUVA, which means psoralen ultraviolet A. In this, after the therapy, the drug psoralen is given. Photoactivated psoralen undergoes oxygen independent as well as oxygen dependent reaction and binds to pyrimidine base, which interfere with DNA synthesis and epithelial cell turnover. PUVA therapy has produced gratifying result in severely debilitating psoriasis, but relapses occur when treatment is stopped. However, there are serious concerns regarding potential of PUVA to cause the skin cancer, cataract and immunological damage. Other applications of PUVA are in lichen planus, urticaria pigmentosa, atopic dermatitis and cutaneous T-cell lymphoma. Adverse effects are mottling, erythema, burns, blistering, premature aging of skin, gastric discomfort, nervousness and insomnia. So in photochemotherapy also we have this kind of side effect. You can see in this diagram, you can see the PUVA therapy, how the arrangement of the device is made to give the proper chemotherapy, and after that the drug psoralen is introduced in the body. Now this was all about photochemotherapy and psoriasis. Now in the remaining slides we will discuss about the demyelinizing agents. Demyelinizing agent, what are basically demyelinizing agent? These drugs lighten hyperpigmented patches on the skin. Okay, so some example of demyelinizing agent are hydroquinone, monobenzene and azelaic acid. Hydroquinone is a weak hypopigmenting agent. It inhibits tyrosinase and another other melanin forming enzyme. So the work of hydroquine is basically to inhibit the enzyme like tyrosinase and other enzymes which forms melanin. It decreases the formation and increases the degradation of melanosome. So basically overall it will decrease the formation of melanin by decrease the formation of melanin and also by increasing the degradation of melanosomes. Melanosomes usually form melanin. The side effects of hydroquinone are skin irritation, rashes and allergy are possible. So these are some kind of side effect of hydroquine. Care is to be taken to avoid its entry into the eyes. Care is to be taken to avoid its entry in eyes. Some example of hydroquine are euchroma, melite and bright. These are some kind of example of hydroquine. The another demyelinizing agent which we are going to study is monobenzone. Monobenzone is basically a derivative of hydroquinone. It is a potent demyelinizing agent. It destroys melanocyte and causes permanent depigmentation. Its bleaching action is somewhat irregular. Ugly, depigmented patches can appear. Erythema and eczema may also result. Therefore, its use should be restricted to post-inflammatory melasomes. 5% of lotion ointment is applied 2 to 3 times daily. Example of this monobenzene is benquine. Azelaic acid. Azelaic acid is a drug for acne that is also effective in hyperpigmented disorder including melasma. It inhibits the melanin forming enzyme tyrosinase. However, it is a weak demyelinizing agent with reversible hypopigmentary action. Azelaic acid is used as 10 to 20% in creams. The only side effect is mild and transient local irritation. So this was all about, we study about the psoriasis, then later on we study about the photochemotherapy and also some of the demyelinizing agents. Now we will focus on the MCQ. So my first MCQ is, which of the following is a common symptom of psoriasis? So by seeing the option, the most common symptom of psoriasis is itching and burning. The next MCQ is, what is the most common type of psoriasis? Among this, the most common type of psoriasis which we could observe in day-to-day life is inverse psoriasis. The other psoriasis like gutted, plaque and pustular are not so common. The next MCQ is based on photochemotherapy. What is the primary purpose of PUVA therapy? So the first option is treatment of bacterial infection, second management of cardiovascular disease, third phototherapy for skin disorder, and fourth prevention of cancer. So basically it is related to skin, so third option will be the correct option, phototherapy for skin disorder. The fourth is, what is the role of psoralen in PUVA therapy? So the same thing, that it sensitizes the skin to ultraviolet A light. So the third option will be the correct one. The fifth MCQ is, what is the primary purpose of demyelinizing agent? So all these demyelinizing agent protect the skin from ultraviolet radiation, and the main work is to reduce the melanin production. So the B option will be the correct one to reduce the melanin production. Which of the following is a potential side effect of using demyelinizing agent? The side effect, if we see, it increases the sensitivity of the skin to sunlight. Thank you everyone for listening.